Good morning. Thank you for joining us today. I'm Kate Behan. I'm CMO for Arcadia.
And I'm Michele Winiarz. I'm actually a user of Arcadia. So CMS has a goal to get every member on a value-based care plan by the year 2030. And so organizations that participate in value-based care or risk-based care really have to continue to be able to invest in the critical competencies of population health to be able to continue to be successful in these care paths. Things like access to care, ensuring that your network integrity is up to date, built up enough to be able to get patients in a timely manner is very important. Being able to invest in care teams like care management, clinical documentation improvement, transitions of care coordinators, community health workers to do social determinants of health screening. All of these things are going to be very important for healthcare organizations to continue to invest in spite of the rising cost of labor and the primary care shortage. So it's really important that organizations understand that they can't take their foot off of the accelerator when it comes to these types of programs. Also, there needs to be the investment in data management and data strategy. That continues to evolve over time, and organizations need to be able to keep up with the changes that are coming down with these policy changes. Being able to house data and aggregate data in a meaningful way, being able to do those deep dives to be able to understand what barriers are facing the population are going to become much more important in the future as these policy changes come into play. So this is just a slide that really shows the importance of primary care services and how they have an impact overall in the value-based plans. This is a slide that shows, we took all the publicly reported CMS data, and what this shows is participating providers and ACOs who had more primary care visits with their patients actually were the top performers in quality. In fact, they had about a 29% higher increase in those PCP visits than the lower performers. Again, just reinforcing the importance of primary care despite the changes coming down the road.
So thanks, Michele. So can't underestimate the importance of really having strong core competencies in population health. This data shows that if you can implement and execute well, you actually can bend the cost curve. So it's not enough just to execute, though. You need the data behind it and the analytics behind it as well to see if you're actually succeeding. So let's take another look at another data set. And so this is the same data set. So this is from Medicare ACOs over a 3-year period. And it's looking actually at low performers and high performers. And it breaks it down by quartile. And if you look on the left-hand side, you can see that for all-cause unplanned admissions for patients with multiple conditions, you can see that the high performers in those ACOs actually had much less admissions, right? So that can significantly bend the cost curve and lead to success in value-based care. If you look at the right-hand side, that's actually looking at hypertension, of course, a chronic disease, and you can see that the high performers also managed hypertension quite well. Another data set, so a subset of the data we just looked at, is again looking at Medicare ACOs and looking at transitional care rates. So transitional care, a favorite of mine. It's a really important part of the care continuum. It's a part of the care continuum where patients actually are at sometimes their most vulnerable. And if you don't support them enough, you can have bad outcomes. And so what we can see here is that for those individual Medicare ACOs, those that had better transitional care rates, so somebody actually engaged them after they get discharged, brought them into the office, and they talked about the care plan. Those that had better transitional care rates actually had more shared savings than those that had a lower transitional care rate. And so let's take a look at a case study. This is a customer of Arcadia's. And so again, bread and butter population health, but important. So their goal was to actually reduce avoidable ED utilization. So they looked at their population, those that were actually going to the ED unnecessarily, and also used predictive scores to look at those that actually may go. And so they actually enrolled them in their care management programs, like some of the ones that Michele talked about. They developed care plans with each of them, and they had educational campaigns as well. And so by doing all of that, by developing, assessing those root causes, looking at those care plans, they actually reduced their overall avoidable ED visits by 23%. So really significant. So again, you can't just implement, you actually have to look at the data and see if you're successful.